Good afternoon. I'm Kari Nadeau. I'm the chair of the Department of Environmental Health here at Harvard-Chan and moderator of today's discussion on clean air. We are in an urgent time for environmental health. The EPA has announced its intention to roll back an array of climate and air pollution regulations. Research conducted right here at Harvard-Chan School shows how these rollbacks will put our health and the health of our planet at risk. Today, we've convened a panel of experts with decades of experience in research and policy to discuss the path forward for clean air. Before I start, I want to mention again that all of you now have books, and thanks to Doug Dockery and Arden who have joined us, we have a book called Particles of Truth that we hope that you will all come and enjoy the book as well as come to signing party in Kresge. I also want to note that in the book, Gina McCarthy, who was our previous EPA administrator, has a wonderful quote that Arden Pope and Doug Dockery are unsung superheroes in the field of air pollution research. And I want to thank them for their courage, and their courage is more than ever important, especially in this day and age. I also want to say that I have a signed copy of the Six Cities paper, so if anyone of you are interested in reading it, please let me know. I want to begin with some questions, and we appreciate that Arden Pope is joining us from Utah. He is the Mary Lou Fulton Professor of Economics and at the Brigham Young University. So, Arden and Doug, you both helped lead the groundbreaking Harvard Six Cities study. You've co-written a new book, The Particles of Truth, about those early days, as well as about the bigger picture of clean air science and policy. Tell us about the Six Cities studies first. What made it so pioneering, and what about that journey inspired you both to write the book? Doug, would you like to go first, and then Arden?
Sure. So my history here at the school goes back to 1974, and it was in that year that Ben Ferris and Frank Spicer and Jack Spengler in fact launched a prospective cohort study to look at the respiratory health effects of air pollution from coal-fired power plants in the United States. The study was using clinical measures of lung physiology to examine the growth of kids in the six cities and the decline of lung function in adults in these communities over the following decade. And we also employed cutting-edge methods to look at new air pollutants, and specifically on fine particles, and specifically on particulate matter less than 2.5 microns, which we've subsequently named as PM 2.5. We were able to show that there were effects on lung growth in kids and also accelerated loss of lung function in adults. But the clinical importance of that was not really apparent, and in fact was debated for a long time. At that same time, Joel Schwartz, who was visiting us as a fellow from EPA, was finding associations between increased daily air pollution and increased numbers of deaths per day in a lot of different cities around the US. And it made us think about mortality in our own study. We had, of course, as we followed up the participants in our study, we would track whether they died and we were lost to the study. And so we asked Arden if he would like to analyze those data. So Arden took on this job and in fact very quickly showed that people living in the dirtier cities were dying faster, in fact dying up to 2 years earlier. And it was very strongly related with fine particle air pollution, the PM 2.5 that we were measuring at that time. It was a pretty surprising finding for us, and it was also sobering in that these were all communities that were allegedly meeting they were meeting the air quality standards at that time that were set to protect the public health. So allegedly they were safe in terms of the health of the population there. But this really suggested that we were seeing significant health effects in the US at those concentrations. And as a result of that, we said we need to do something to validate this. We questioned the results ourselves, and we wondered, well, what can we do to validate these results? We're not going to start a new prospective cohort and wait another decade before we saw the results. But fortunately, we had a connection to the American Cancer Society, who were doing a massive prospective study of the causes of cancer in the US population. But they weren't looking at air pollution. We went to them and said, well, could we match the residences of your participants to air pollution levels that were being monitored across the country, specifically the PM 2.5 concentrations? And they said yes, but it was a massive task, a very difficult problem, and we asked Arden to take this on, and he went down to Atlanta and worked through this, but very quickly showed that we could see the same associations in this different population. So it gave us confidence that there was a real association there, and we published these results. And very quickly, it was recognized that this had major implications in terms of a new pollutant that hadn't been identified before, and a clear public health risk in early death. And so as a result, in 1997, the Environmental Protection Agency proposed a new standard based on these new pollutants, PM 2.5. In fact, it promulgated a standard and set up a monitoring program across the United States to measure concentrations. And as a result of that, we've actually seen very, very substantial reductions in particle concentrations across the United States. And we've been able to show that this has led to measurable improvements in health in these cities. And at the same time, this also generated a wave of new science, new investigations to understand what the associations were with this new pollutant, PM 2.5, what the pathology was, how it worked, and what were the other health outcomes. And that's been a major research initiative here at Harvard, but at institutions all across the United States and indeed all over the world. These results have now been replicated all over the world. They were also challenged, as you can imagine, very broadly. The studies themselves were challenged. We as individuals were challenged. Environmental epidemiology was challenged as a legitimate base for making regulations. And in fact, we've seen science being challenged, and the trust for science by the public has been undermined, and we continue to see those effects. But nevertheless, we've continued on, and this book is actually about that journey.
Thank you. We are so honored and privileged that both authors are here today, and thank you for Particles of Truth. It's an excellent book. Arden, I was wondering if you could comment on the pioneering efforts that you took with Doug and your role in inspiration for writing the book together.
Yeah, well, it's been a very interesting journey. There's no doubt about that. I came into the air pollution arena sort of by accident. I studied I did analysis on a very unique and interesting natural experiment here in Utah, where a steel mill, which is the major polluter in Utah Valley, shut down for 13 months and reopened. And the results were amazing, very interesting. I published those results and sort of, and then Doug and I became acquainted and started doing research together. But when I went out to Harvard on a fellowship there for a year, I was actually very grateful and quite excited that they offered to allow me to sort of analyze the data, try to interpret the data. And the first thing I noticed was how how elegant it was, how clean the data was, how well it seems to have been organized and put together. The analysis itself was not especially hard, and the results were pretty obvious. The big concern is that none of us, or at least certainly I didn't expect the apparent impacts of air pollution on mortality, both respiratory and cardiovascular mortality. I didn't expect that they would be that large. And as Doug has already pointed out, we were actually very, very concerned about these results, and were the very first ones that wanted to make sure that we could replicate them in an independently collected cohort. The analysis of the American Cancer Society cohort was a bit more of a challenge, just because it was a much bigger cohort and it wasn't designed specifically to look at air pollution. So we had to connect air pollution data that was available to us with the ACS cohort and analyze it. But of course, when we got very similar results from it as we got from the Harvard Six Cities study, we knew that these were incredibly important findings, and they needed to be published, and they needed to be replicated in other ways as well. But at that point in time, we were satisfied that the impacts of fine particle air pollution were probably big enough that there ought to be changes in the standards, and there ought to be substantial efforts to try to protect human health from breathing these pollutants.
Thank you. It's really an amazing example of how people can come together, collaborate, and then have a product that has such a substantial impact that it affects the whole globe. Mm-hmm. And so at Harvard and Harvard Chan specifically, we want to focus on excellence and knowledge generation, and also knowledge dissemination. And so we have a lot of students in the audience as well as online. And I was wondering if both of you could comment upon to what degree you feel your book will enable and help education in environmental health, and what does that look like for the future?
So I think both of us were very concerned that this book goes back over 40, 50 years of history now of doing air pollution research, and this is all documented in various peer-reviewed papers. I mean, you have one example there. There's hundreds and hundreds of papers, and it's very hard for our students. It's hard for the general public. It's hard for the regulators to assimilate all that information. Yeah. And so one of the things that we've always been proud of is trying to make the research accessible and easily understandable to the reader. And as Arden said, the Six Cities study in particular had that characteristic, that it was a very elegant design and very easy to understand what was going on there. But there really wasn't a compilation of all this information, plus the personal history that goes along with this. Exactly. Of how you actually do science. I mean, we tend to think of it as a straightforward path, but it really isn't. There certainly were a lot of diversions, dead ends, unexpected complications as we move through this process. And to help our students and other people understand how this all came together, to provide a comprehensive history in some sense, and also to provide not a roadmap, but a guide to how we got here. So Arden instigated this, originally thinking of this as a textbook, but as we develop the book, I think we're very happy to see that I think it is more accessible to the general public.
Absolutely. Arden, do you have any comments?
Well, I agree with Doug on that. I mean, we really wanted this book to allow interested readers to learn about the importance of clean, healthy air. And everybody understands that having clean water, having adequate nutritious food is extremely important for our health. But we wanted to make it very clear how important it was to also have clean, healthy air. And I mean, Doug and I, we've done a lot of research together and with other research teams as well. And Doug and I even wrote a fairly substantial critical review of the literature some years ago that's been widely cited, but it's mostly just by other academics and scientists. So what we wanted with this book is to tell the story about the research, wanted to tell why we know that, how we know that air pollution is or clean air is so important. And then we wanted to tell it in such a way that it was an engaging story and enjoyable to read. And of course, we got a lot of help from excellent editors, and we appreciate what they've done to help us make this book readable and accessible to a broader audience.
Thank you. I'd like to turn now to my other colleagues on the impacts of human health, and Amruta and Mary. You have both examined specifically how clean air benefits health. What is the research on reducing air pollution, say, and can you put that into the context of health benefits as well as economic benefits? I'll turn to you, Amruta, first.
Sure, thank you. That's a great question. And the first thing that I guess I want to mention is that it's hard to overstate how impactful this research has been over the course of regulatory frameworks in the United States. So one of the things that I want to emphasize is that, here in the US, we're used to breathing relatively good air, relatively clean air. And I don't think that's something that we can take for granted. That happened because there was this early evidence of the mortality impacts, because there have been follow-up studies of the health impacts, and because we've done a fairly good job of regulating air pollution levels across the US. And this is something that's a worldwide issue, right? So the World Health Organization likewise has developed standards for PM2.5 concentrations for health. And there are a lot of people who live in a lot of urban areas around the world who are living with baseline levels of air pollution exposure that are higher than what's recommended by the World Health Organization. And we can look to some of those communities to see what the health impacts look like. And we see that there are higher mortality impacts from PM2.5 exposure. We see a whole host of other types of chronic and acute health outcomes that occur. Both of the speakers earlier mentioned cardiovascular disease risk, respiratory illness. I think Mary will talk a little bit more about that. But the other thing that I want to mention is that there have been a series of studies that have been conducted on the economic benefits of the Clean Air Act in the United States. And it turns out that we can consistently look across all of these different mortality outcomes as well as different illnesses, and we can see that there has been a many-fold return on that initial investment to reduce our air pollution exposure in terms of the economic benefits to health. So I think it's really important to highlight that this is something that our communities across the United States have really benefited from this regulation.
Thank you. And Mary, this has also been of a high research priority for you in terms of looking at air filters and other aspects of pulmonary health. And you are also a physician, so I was wondering if you could also comment.
Yes, so I am a pulmonologist, and I've spent most of my career studying the respiratory health effects of air pollution exposure. And those tiny invisible particles that Doug and Arden identified as a cause of premature mortality make their way deep into the lung, along with the gases from combustion, where the injury and the inflammation begins, that then can have systemic effects, spill over into inflammatory pathways into the bloodstream, and that explains extensive burden that we see throughout the body of air pollution exposure. But to focus on the lungs, together with my colleagues here at the Harvard School of Public Health, we have found that air pollution exposure in the United States at relative typical levels that we breathe every day harm respiratory health, even in the general population, not just people who have existing lung disease. So to give an example, the pollutants that the US EPA regulates, like PM2.5, nitrogen dioxide, ozone, When the levels are higher, we have found that lung function of generally healthy adults is lower after just 1 day of exposure. That's just 1 day. And it's the cumulative effects of air pollution exposure that are most concerning. So to give you some examples, respiratory examples, in our own work we found that kids who live closer to busy roads in the Boston area have 3 times higher risk of asthma than kids who live further away and are less exposed to traffic pollution. Generally healthy adults, in Framingham Heart Study, those who are more heavily exposed to pollution have more rapid loss of lung function over the years. And to put those effect size in context, similar to the magnitude of effect on lung function as having smoked in the past. Another example, we've looked at the chest images of healthy adults, and we found that those who are more heavily exposed to pollution have changes on their CAT scans that a form of scarring that's similar to what you see in people who are exposed to dusts occupationally in their jobs. But I think it's important not only to look at these harms, but to look at what happens when air quality gets better, as you were asking, Kari. And there are so many important studies that have looked at that. In the same population where I mentioned the higher risk of asthma, these are kids in Project Viva around Boston. The children who had greater improvements in air quality, greater improvements in PM 2.5 over several years, had faster growth in their lung function compared to kids who had less improvement in air quality. The Children's Health Study in Los Angeles found that as air quality got better over the last 20 years, the risk of asthma was reduced by 20% on average. A famous study of short-term exposure that during the Atlanta Olympics there were traffic restrictions, and that lowered traffic-related pollution. And investigators looked at claims for asthma and found a 40% drop in Medicaid claims for asthma that went right back up again when the air quality got worse. And I think those studies are really important to highlight because they show that while these health harms of air pollution may be invisible, those benefits are immediate and very valuable.
So I hope you all see that we're really focusing on trying to think about solutions, and you all can probably think about that in your own lives as to how we can do better. We have other and many other researchers here at Harvard Chan, including Francesca Domenici, who's done work on coal scrubbing as well as termination of coal fire plants, and that has also shown that that can improve mortality and morbidity. So I think the wealth of research is pointing towards solutions. As also an allergist and working together with Mary as a physician, I wanted to mention that it's important to, as we talk to the public, as we think about our own selves and focus on public health, air pollution can be synchronously exposed when someone has a heat stress issue or drought or food insecurity. So when we think about exposures, we need to think about holistically for any one person. I am an allergist, and unfortunately, literally, when air pollution goes through the sky, it will glom on like glue to pollens. And with that, when people intake the pollens, and this season is pollen season outside, it worsens their pollen allergies, and it also worsens their lung disease. So we need to think about, for any person as well as to the public, how important it is to look at multi-exposures and how we can reduce health risks due to reductions overall in many of these environmental toxins, for example, including air pollution. And with that, there was a great study that was done in New England here. So for every dollar put into renewable energy, for example, there were $6 out just for children's co-benefits, and that was published by our colleagues at BU as well as Columbia University. So I think it takes a village to be able to do this. It takes community-related research. And I'd like to now move on these issues around climate, around multiple exposures, because there are a lot of impacts on the intersection of our health, our public health, with planetary health. And when you look at some examples of how drought, heat affects wildfires and wildfire smoke, which is a form of air pollution. How do you think, and Amruta, if you don't mind speaking to this, how do you think some of the recent work that we've been doing through Harvard Chan in the Los Angeles Fire Health Study has been enabling our ability to do collaborative research, look at multidisciplines, look at multiple exposures over time, and how that might affect people's health and our planet's health?
Sure. So I think that this is a really fantastic example of a lot of these different concepts that you mentioned. So for those who are not familiar with this event, in early January of this year, there was a huge wildfire, devastating wildfire, and it was actually a series of 3 or 4 small wildfires throughout the Los Angeles area. And this wildfire happened in a time where we wouldn't normally expect to have that level of burn. And the other thing that I think is a really important feature of this specific wildfire event is that there are some differences in terms of the air pollution that people experience if there's a wildland fire that's happening mostly in a forested area, in a wooded area where there's biomass being burned. By comparison, in Los Angeles, which is a very heavily urban area, a lot of houses were destroyed, a lot of cars, a lot of other urban infrastructure, which leads to a different chemical profile, right, of the air pollution that people experience. So there might be different types of pollutants that are when we say PM 2.5, what we're talking about is a wide array of different particles. It can be black carbon, it can be organic carbon, it can be sulfates, it can be a whole host of other different small particles, but that's going to be different depending on if it's a tree that's being burnt versus if it's a building or a car or a sofa being burnt. And so a lot of different chemicals were being released into the atmosphere. But the other thing that I think is really important to mention is that it may be coming on top of these intersectional risks, these intersectional environmental risk factors. So a period of very intense drought that's followed by a wildfire, or we can think about a longer wildfire season where people may be exposed to wildfires that they wouldn't have ordinarily been exposed to during that time frame. The other thing that we've seen recently, so this is maybe going back further than the January wildfire, but for those of us who were in Boston last year, we remember that there was long-range transport of wildfires. There were wildfires happening in Canada, and people in Boston and New York City were experiencing that smog. So we're not just worried about the local effects of that air pollution exposure. We're worried about where else is it going, who else might be impacted by that exposure. And in the Los Angeles study, I think we were particularly well situated to go in and start to look at some of the very acute changes that were happening in the local environment. So some of our colleagues here at the Chan School, led by Joe Allen, were able to go and take some measurements of indoor air quality immediately during the wildfire, in the wake of the wildfire. And what they found is that there were increases, particularly in the PM 2.5 levels in indoor air, initially following the wildfire period. Additionally, there was a study that was looking at firefighters, so first responders, who are some of the folks who might be the most vulnerable to the adverse effects of the wildfire exposures. And the initial results from that study showed that not only did the concentration of lead increase in the atmosphere, in the air, but the concentration of lead in the cells of firefighters that were exposed to the wildfires, the lead concentrations were also 5 times higher than in the comparison group. So these are, once again, immediate increases in the exposure to the different particles. And also, we're immediately seeing that that's translating into changes in the profile for different vulnerable populations in those communities. And so this study is going to be continuing, looking at what are some of the other types of health outcomes that were associated with the wildfire smoke. Recently, I've been collaborating with a researcher at the American Cancer Society, and we found that there are health implications in terms of the health outcomes. There are also implications for the ways that people receive care. So we were looking at patients who had lung cancer surgery as a treatment for their ongoing lung cancer, and patients who were in facilities that were close to wildfires had a longer length of stay compared to patients who were in in for surgery in areas that did not have exposure to wildfires. And what that means is that there might be costs that aren't even associated with the health outcome itself, but costs to the healthcare system that are associated with these continued episodes of wildfires and air pollution as well.
Thank you. It is a huge and important topic to be able to think about the climate and what is occurring around global warming. And I'm very grateful for Arden and Doug to be able to have a section in their book about climate and how that will affect air pollution and vice versa. And in that, we want to give hope and promise today that many solutions are being studied at the Harvard Chan in many places around the country. So, Mary, with your research, with other people's research that you're aware of, what solutions can people consider as they think about protecting themselves from wildfire smoke and other forms of air pollution?
Well, I think you can start by looking at the data that's available to you to show you what your exposure level is broadly. They're talking about air pollution broadly, not just wildfire smoke. So the US EPA monitors the pollutants that are regulated, fine particulate matter, NO2, ozone, and you can look it up on airgov.now, and you can see what the air quality is in your region. And those who have lung disease or heart disease and are more susceptible to the health effects of air pollution, I would really recommend that if the air quality is in the moderate range, so an air AQI of 50 to 100, that you consider taking steps to protect your health. If you, even the general population should consider taking steps when the AQI is over 100. That's telling you what the air quality is in the region. It might be very different during an acute wildfire event. And I can tell you that right after the horrific fires in Los Angeles in January, many of us, I know I was, Kari, Amruta, were all contacted by people from Los Angeles asking, how can I protect my kids? How can I protect my mom? What should I do? Well, there are some things that we know are helpful, and there's also a need for more research in this area. So we know, for example, that people who have asthma that the wildfire smoke is more toxic per unit mass than particulate matter from other sources, right? So especially if you have chronic lung disease, take some precautions. So staying indoors with the windows closed if the air quality is poor. Thinking about sources of pollution inside your home. It's not just outdoor air pollution. So gas stoves are a source of indoor pollution. So making sure if you have a gas stove that it's properly ventilated and consider replacing it with a stove that doesn't burn gas, so an electric stove. Air purifiers. In our work here at the Harvard Chan School of Public Health, we've found that HEPA air purifiers really are effective at reducing pollution indoors. Even when the baseline level of pollution isn't that high, a properly sized HEPA filter, which is a high efficiency particle filter, will reduce fine particulate matter by about 50% on average. So that we know it works in reducing exposure. We also know from other studies, mostly asthma studies, that it can be valuable in reducing asthma symptoms for people with allergic asthma. There isn't a lot of research out there yet for other chronic conditions. My work is on chronic obstructive pulmonary disease. I'm doing a one-year air purifier intervention for people who have COPD. There's also ongoing work for people with cardiovascular disease. So I think that is an important need. I think that there is one other type of intervention that doesn't always come to mind, but if it is an extreme situation, right, smoke conditions, N95 respirators are 95% efficient at removing particle levels. So if there's a situation of high smoke conditions and it's unavoidable, you have to go outside, that is a personal intervention that people can undertake.
Thank you. I'd like to now move on to lessons of inspiration. And many of you here in the audience have also been inspired by Doug and Arden and mentored by your wonderful research and teaching. I'd like to, Doug and Arden, ask you, in your book, if you now could tell us a little bit more about the complexities and about the special interest groups that added to some of the interesting history around the Clean Air Act, as well as your own research with this quote-unquote secret science that was mentioned in your book, as well as what's happening around the country. What does that mean? How do we continue to do science despite some communication efforts that might be challenged, and then despite science that can be challenged? So do you mind talking about that for the audience to hear about that history, as well as how you had the courage to move forward?
So it hasn't always been pleasant, but we knew in going into this work, when we started, it was with the intent of providing information for standard setting, and we knew there would be pushback from special interest groups. It's very discouraging to see where we are now with the distrust in science and the general problem we have with the credibility that we have in the general public. And it's not, as you think about how we do science, its traditional method is you develop a hypothesis, propose a hypothesis, and actually you're not trying to confirm that, you're trying to disprove that hypothesis. We do things by showing that they're wrong. And in fact, we welcome that. And in fact, our work, I think we have tried very hard when we found connections, associations, correlations to show that those aren't real, and work very hard at that. So in many senses, the epidemiologist, because that type of data is subject to a lot of potential problems, and we recognize those and actually talk about them a lot. We are our own worst enemy, and people can pick up on those. But we do welcome real critiques of our data as well as our own. We welcome opportunities to work with other scientists to investigate and challenge the results. And I think this book for us was an opportunity to talk about not just the direct results, but also the dead ends we ran into, where we had problems, what we did to face those. It's not a straight path, and it's something that we have to deal with all the time. But it's very unfortunate that there is also groups that feel they had the only way, or one effective way, to challenge these results is to emphasize those uncertainties. And if you're a good scientist, you do talk about the uncertainties in your results. But clearly a interested party might pick up on those and talk about, well, all the uncertainties there's so many uncertainties that we cannot move on this science. It's not the basis for setting a standard. And it can, in fact, turn to potentially suggestions of erroneous data or fraud in some cases, and we've certainly experienced those types of things also. And you have to have confidence in your work, but also being open to being challenged and trying to sort through what are legitimate criticisms and what are simply criticisms to delay any action being taken. And Arden and I got together initially because he had published this wonderful study in Utah suggesting that the steel mill there was having very significant health effects that was clearly demonstrated when the steel mill went on strike for 13 months. And yet he was being challenged by the local business community. Why are you beating up on this key industry in Utah Valley. And actually, our first conversation was, where can I get some more help? I'm just a poor agricultural economist out here. And I'm not an epidemiologist, and what can we do together to work this through? And it was I think it was very fortunate for both of us. But maybe, Arden, you can comment on what your experience has been.
Yeah, well, yeah. I mean, I think it was fortunate for both of us. At least, certainly, it was fortunate for me to be able to work with you and your colleagues there at Harvard. Not only did I get great training, but had great colleagues to try to do this work. I will point out that one of the things that Doug and I have tried to do over the last several decades is, as there's been distractions and criticisms and various things, is we've tried not to get too distracted by these controversies and criticisms. Now, this isn't always easy. I'm not saying it's not sometimes annoying. But what we tried to do is focus on listening to the legitimate concerns related to our research. And then we tried to move ahead and address those concerns, and not only understand them, but address them. And in fact, some of our best work has come from trying to understand and address very legitimate complaints or concerns about what we've done. And a lot of that has been done with other colleagues, and in some cases been done, with directly collaborating with the individuals that were criticizing the original work. And then, specifically with regards to the secret science issue, I mean, that's somewhat of a complicated issue in a way, because all of us really do believe in sharing data and having our work scrutinized and reevaluated. On the other hand, there are studies that we've done that have confidential data, which ethically and even legally, in many cases, we're not really allowed to release publicly. But even with regards to that, Francesca Dominici and Joel Schwartz were mentioned earlier, but they've been involved with using publicly available data, at least as publicly available as it can be, in terms of using U.S. Medicare data. They've done really these massive studies looking at air pollution and mortality in the Medicare cohort. I've done studies actually working with a research team that originally investigated the Harvard 6 cities in the ACS study, working with Dan Krusky, Rick Burnett, and others, where we've used National Health Interview Survey data, which is public data. And so the point, of course, there is sometimes the criticism has to be largely ignored just so you can go on and do your work. But a lot of the times you take the criticism to heart and try to use it to improve the research that you're doing as you move on. And I don't know that Doug and I have done this perfectly, but we've tried. That's been the approach we've taken. And for the most part, we have had some success, and we've been able to increase our knowledge about the health effects of air pollution and the importance of clean, healthy air.
Thank you, Arden. On that wonderful note, I hope you've all been inspired, I certainly have been, to be able to think about some of the comments that we've discussed today. I want to thank you all for coming. We've given some approaches, and I really appreciate the history and the knowledge in the room in terms of people that are researchers and educators, as well as helping out public health practitioners and students and individuals, help them sustain the Clean Air Act and to breathe healthier air.